would it be like to live in a world where your thoughts and perception feels out of touch with reality? How would you navigate daily life if you experienced hallucinations and delusions that felt completely real? Now, did you know that according to the World Health Organization, 23 million people worldwide live with schizophrenia? Now, schizophrenia is a serious mental illness that can impact a person's thought, feeling, and behavior. So we're going to move to our first point, the cause of schizophrenia. Schizophrenia is a complex and serious disorder and not fully understood. Now, there was a study that was approved by the Institution Review Board of Shanghai Mental Health Center in China. Studies included 2,425 patients with schizophrenia, found that 19% of the patients had family history of mental disorder. Schizophrenia is a common form of psychosis, and that is a medical condition that changes the way a person perceives reality. Our next slide. Our next slide, diagnosis process. To have a diagnosis process, a doctor performs a physical exam and conducts a thorough review. Now, a person must experience at least two of the following symptoms, most of the time during a 1 month period with some level of disturbance. For example, delusion, hallucination, disorganized speech, or neglect basic hygiene, and the doctor may add additional testing, which would be an MRI or blood testing. So now we will move on to our next slide. Okay, the medication treatment. Now, schizophrenia typically involves a combination of medications. One of them is antipsychotic and psychosocial intervention. Antipsychotics are drugs that help manage the system of delusion and hallucination. But there was one study that is currently underway at the Center for Medical Ethics, University of Oslo, led by Dr. Hetmar and his team. And based on this, that family interventions, the investigations assume that the main benefits of family intervention is to help people with schizophrenia that may decrease the risk of relapse. So that is medical treatment, and we will move on to our next one. There are different types of schizophrenia, and one of them is paranoid schizophrenia. Now, this is a common schizophrenia, and it is developed later in life. And the symptoms include hallucination, delusion, speech, and emotions may be affected by this. The next schizophrenia is called hyperphrenic schizophrenia, and it's also known as disorganized schizophrenia. This type develops between the ages of 15 and 25 years old. Now, symptoms include disorganized behaviors and thoughts alongside with short-lapsed delusions and hallucinations. And our last type of schizophrenia will be catastrophic schizophrenia. Now, this is a rare schizophrenia diagnosed by characters, but usually is limited and with sudden movement. Person may switch on and off with this one. So those are the three types of schizophrenia that are prevalent. Our next one is our conclusion. So remember that schizophrenia is a mental disorder characterized by disturbance in thoughts, perceptions, and behavior. Understanding its cause, diagnosis process, Medication, treatment, and types of schizophrenia options are essential for reducing stigmas and support. Remember that your mental illness, your struggles, do not define you. Take care of your mental health and act in self-love. The end. Stand up and face the audience. Stand up and face the camera. Now put it off.
The